Hi everyone, welcome to Feminine. I'm Dr. Neha Gupta and this is a video about ovarian cysts. So ovarian cyst is a very common condition. I think about 10 out of every 100 women, so that is 10% of the women will develop the cyst at some point of time in the entire life. So what are actually ovarian cysts? Ovarian cysts are circular bag-like structures containing a liquid. So जैसे पानी का गुब्बारा होता है जिसमें कि बाहर एक प्लास्टिक की कवरिंग होती है और अंदर पानी भरा होता है, उसी तरह से ओवेरियन सिस्ट होती हैं। ये ओवेरियन सिस्ट जो होती हैं दे कैन बी सीन आइदर ऑन द सर्फेस ऑफ द ओवरी और दे कैन बी इनसाइड द ओवरी, डीप सीटेड इनसाइड द ओवरी. Ovarian cysts can be of different types. So if we have to broadly, they can be divided as the benign cyst, यानी कि the non-cancerous cysts and the cancerous ones. We are basically going to focus in this tutorial on the non-cancerous or the benign cyst. So what are the different types of benign cyst? The first is the follicular cyst or the functional cyst. Many a times when you go for an ultrasound scan, there will be a finding that there is a 2.5 centimeter follicular cyst in the ovary and you start worrying that you have developed a cyst in the ovary. But actually there is nothing to worry about such a cyst. These are the cysts which can form in the ovary because of the normal hormonal changes that happen in a menstrual cycle. These are completely benign, completely harmless cysts, and most of them will disappear over the period of 2 to 3 months on their own without any treatment. So we don't need to worry about the functional or the follicular cysts. Now then there is another type of cyst which is called as the dermoid cyst. What is this cyst? It is a special kind of a cyst because in this cyst not only can we find liquid inside the cyst, but we can find things which are developing from the different cell layers. Like there can be hair present inside the cyst, there can be a tooth present inside the cyst, there can be fat present inside the cyst. So yes, we start suspecting that this could be a dermoid cyst on the basis of the ultrasound findings that we see. And if we need to do further testing, you may be asked to do an MRI scan to confirm that you have a dermoid cyst. 99.9% of the times the dermoid cysts are they are non-cancerous or they are benign cysts. And then you have the other benign tumors or the non-cancerous tumors like the serous and the mucinous cyst adenomas. So these are little more serious kind of cysts, although they are non-cancerous, but they have they can develop to very large size. They can become even as large as 15 centimeter, 20 centimeter, extending right from your ovaries and occupying the whole of the pelvis and the tummy and going right up to your liver. They can become such huge cysts in size. And generally if we are suspecting that somebody is having a benign tumor of the ovary, then definitely that needs to be removed. So when do we suspect that somebody is having a cyst in the ovary? So the ovarian cyst, as I have told you, they can be of various sizes, right from 3 centimeter to anything like 20 centimeter. It can be a very simple cyst in which there is just a clear liquid inside the cyst. There are no solid areas, there is no particulate matter in the cyst. Or it can be a cyst of a more complex nature, like the cyst has multiple compartments inside it. The liquid that it contains is not a clear liquid but a thick liquid, or there are solid areas, irregularities in the surface of the cyst. Or on the ultrasound, if the cyst shows very high blood flow to it, then all those features are not very good features and we start thinking in terms of more serious type of cysts. So a lady can have irregular menstrual cycles because of the cyst. Her cycles can become painful because of the presence of the cyst. There could be vague symptoms like pain in the lower part of the tummy, heaviness in the lower part of the tummy because of the cyst. If the cyst is larger in size, it can lead to a swelling of the tummy, almost like that of a pregnant lady. It could start pressing upon the urinary bladder, so somebody can have increased frequency of urination. It could start putting a pressure on the bowels, so there could be altered bowel habits. There could be bloating and retching. So all those non-specific symptoms can also be there. One very different type of cyst is the chocolate cyst of the ovary, about which I have talked in detail in one of the other videos. That is again a diseased condition and that needs to be treated. So once we suspect an ovarian cyst in a lady or in a girl, we have to confirm it. Usually that is done by the help of an ultrasound scan. You may be advised to do certain blood tests as well. These blood tests are called tumor markers. Now, there are specific tumor markers which can become raised in specific cancerous conditions. So, to rule out those conditions, you would be advised to undergo these tumor marker tests, and sometimes to know more about the cyst, to plan the management of the cyst, you may be asked to undergo further imaging by doing an MRI scan or a CT scan, as will be advised by a gynecologist. Coming to the treatment part of it. So not all cysts, as I have already told you, will need treatment. If it is a functional or a follicular cyst which is just about 3 centimeters in size, then you do not need any treatment for such a cyst. It will go away on its own over a period of 2 to 3 menstrual cycles. But if it is a larger cyst, say if it is a cyst which is around 6 centimeters or 7 centimeters in size, if the cyst is kept in an observation and we find that it is increasing in size continuously, if the cyst is giving you a trouble, like if it is giving you pain or if it has become very large in size, giving rise to problems with the urine or the bowel function, then you need to operate upon this cyst. The surgery that is usually offered is a removal of the cyst, a procedure which is called cystectomy. And this surgery can be done in most of the cases by the way of a laparoscopy, which is a minimally invasive or a keyhole surgery. So there will be no large cuts on your tummy, just very tiny 5mm cuts are given, and the surgery is performed through small instruments passed through these tiny cuts. Dermoid cyst is again something which will need to be removed in most cases. Cystectomy is the surgery offered, which is done laparoscopically. And as I've told you, if it is a serous or a mucinous cyst adenoma, which are actually benign tumors of the ovary, then depending upon the age of the girl or whether she has completed her family so far or not, a decision will be taken. It is safer to go for an oophorectomy, which is the removal of the ovary in such cases. So even if the one ovary is removed because of the presence of a benign tumor and you have the other ovary which is healthy, then very much the pregnancy and periods are possible even with the presence of a single ovary. In the cases of benign tumors, decision whether only the cyst has to be removed or the whole ovary needs to be removed, that decision is taken on the basis of the lady's age and her reproductive history, that is whether her childbearing is complete or not. For the other cysts which are not at all cancerous, in those cases mostly it is just the removal of the cyst which is performed and not the ovary. Any cyst in the ovary in a post-menopausal lady, for a lady who has attained her menopause and then she develops a cyst in the ovary, that is always viewed with a suspicion because of the increased risk of ovarian cancers in post-menopausal women. And generally, if such a cyst is there and it is persisting, or if it is more than 5 centimeters, it is safer to undergo an ovarian removal surgery in these women. So that was briefly about ovarian cysts. If you have any questions and doubts, leave them in the comment section and I would try to reply to each of those queries. Hope you found this information a useful resource. Thanks and bye-bye.